so much easier to get over than a total knee. You want to treat it earlier. And so I'll do a 90-year-old, no problem, with a partial knee.
Well, for a couple of years I've been having a lot of knee pain and walking. I probably since about 2006. When I walk anywhere, I usually have to use a cane, or I kind of hobble. I take a cane just for insurance in case my knee gives out on me. I have arthritis in my both knees. So I decided, well, I got to get something done with this, because a friend of mine told me if you live another 10 years, you don't want to be like you are now, so you better get something done. So I decided, I asked my primary care doctor who I should contact, and he suggested Dr. Velyvis. And I went in and visited, and he looked at me, we talked a little bit, and I decided I had to have it done. I couldn't go on anymore with the pain. Where would I be now? Yeah. Probably just sitting in a chair at home. I wouldn't be doing very much, I'll tell you that, because I had a lot of pain from the arthritis.
The robotic assist makes it so precise and quick with a good recovery that we've had no trouble with our 90-year-old patient.
Are you teaching other doctors how to do this procedure?
All the time. People are coming in to observe me doing surgery, and I'm going out into the areas of the United States to teach this to other surgeons.
Okay, now of all of the, I guess you say 650,000 nationwide total knees.
Total knees.
How many of those could have been prevented, in your opinion? What percentage could have been done with this new
Well, in my
technology?
practice, that's all I can speak to is before I got the robotic system, I was doing about 10% partial knees, doing the old style thinking, which is what I learned in my residency and in my training. Since I got the robotic system, I'm now doing 50% partial knees and 50% total knees. So it's a huge increase in my partial knee, and I think my patients have been appreciative of it, and they loved it.
You know, before you had this technology, you were doing partial knee. Why? Because it was less effective, in your opinion?
Yeah, I just didn't really believe in the partial knee as much, and I wasn't seeing as big a difference between a total knee and a partial knee. And so that was kind of the way things were going, and that's the way it is nationwide. When you start to expand your horizons, learn about something, take the time to learn it, travel, get trained on it, it takes a big effort. But then you start to change your thinking. It really does benefit the patients, and that's why I've expanded my practice into the partial knee realm much more.
But there's a preventive aspect to this.
That's right.
That I didn't think about going into this.
People at a much earlier stage of disease. We don't want to make them wait and suffer through many years, less gym activity, less travel, suffer, suffer, suffer until you need a total knee. We can treat that earlier now because we have confidence it's going to last a long time.
Interesting, interesting. So people probably think about they live with this knee pain probably for 10 years before they finally do something about it. And by then it's too late.
Some people do. And I tell you, the vast majority of my patients tell me I waited too long. Whether it's a total knee or partial knee, everybody waits too long because nobody wants surgery. So we offer non-surgical options as well.
On day one, what do they want to know? Okay, so they see this, they come in. What do they always want to know?
They want to know, what's my recovery going to be like? So the recovery is like this. On first day after the surgery, within 3 hours, you're up walking on your new knee. There's no wheelchair involved. You're walking full weight immediately. So the recovery is very quick. You go home the next day after surgery. In fact, I've had a number of patients who've gone home the same day of the surgery, which is remarkable.
All right.
After that, minimal pain. Some people have more than others, but overall, my patients are so much happier with less pain. They feel much more natural earlier with this new surgery.
So ideally, the golfer, how soon before they're out?
Yeah, I think that they are chipping and putting within a month and playing a full round of golf at the 2 to 3 month mark. I think my average is around 2.5, 3 months, but I've had plenty of patients do it within 1 month, which is remarkable. It never has happened before.
What about Stairmaster or a treadmill at the gym? What do you recommend?
Yeah, going to the gym is really excellent. We want you to keep your muscles strong, keep that osteoporosis out of your body. So in fact, once you go home, we send a physical therapist to your home to help you exercise and get moving as fast as possible. We recommend you go to the gym, get back to your normal activities, and we do that much faster now with this new surgery.
So do they feel like it's their regular knee? Do they tell you that?
I think that I've seen a big difference in what patients come back and tell me. It feels a lot more natural. The recovery is quicker. They feel like they're not limited in any way, and it makes for a more healthy lifestyle overall.
Okay, but you are an orthopedic surgeon. I said this early on. Is that the number one fear, going to you and saying, what do you think, doctor? Because, of course, look, everybody always thinks, or at least that's what we always say, that
it comes from patients.
You're thinking surgery.
Yeah, and they need to know that we are a comprehensive system here that offers other things, physical therapy, injections, pain medications, shoe wedges, other things that don't involve surgery to help you get over that pain. For those people with chronic pain, despite all the other things, they come to surgery, and that's what I love to do, and that really helps the patient over the long term.
Okay, so ask your doctor. So obviously go to an evaluation with the doctor that does the robotic GPS-guided surgery and also does full knee, partial knee. And
you want to have somebody who offers comprehensive care. Because then all your options are available to you, not just surgery.
What about tougher sports like tennis? A lot of twisting, moving.
Yeah, because it feels so natural, we have plenty of patients that get back to the tennis game, hiking on uneven surfaces. It takes a little bit longer to do that than a golf game or walking in the shopping mall or on vacation. But there's no restriction against it, and we encourage it.
So for some people, they get their life back. I mean, a lot of people, because of their pain,
we want them to go back to work. We want them to go back to the gym. We want them to sleep at night. We want them to be healthy.
All right. Men and women, is it mixed? Do women go in sooner? I always hear that women will take care of things sooner than men.
I think in general men are resistant, but it goes across the board. I think more women have arthritis than men, generally speaking, so we treat more women right now. And we're encouraging all people, men and women, young and old, if you're having an achiness in your knee, there's no reason to suffer in silence. Getting some information from a doctor can be helpful.
It's all on your website?
Start with the website, look on the internet, search it, look it out, get some information, call us up and come and talk and discuss it. We can diagnose you, we can give you your options.
Any misconceptions, by the way, out there that you hear as a
The main misconception is that it's painful and it doesn't always work. And by having a robotic surgery, we think it works much more consistently and precisely, and we think that we've seen the great results that should start to allay the fear of the public against having knee surgery if it's required.
Will they meet with you on a consult?
Absolutely.
If they want to?
Yeah, they always will see me.
Now we're out of time. You brought a clip of the procedure. What are we looking at?
Okay, so what you're looking at is a three-dimensional model of the patient's actual knee. This is specific to that particular patient. You're looking at this area, and this is what we've determined as required for bone preparation to put this implant on. And you're also looking at a cartoon of the burring tool, which is the actual thing that prepares the bone, slowly taking off the bone to prepare it for that implant perfectly and precisely.
So a better fit, should last longer, feel better, allow people to really get active again.
Yeah, and we've seen the results. They've told me about the differences themselves.
Now, in all areas of orthopedic surgery, because you do hip, knee, and everything, is that correct?
Yes.
Okay, is this the happiest group of patients?
All my patients are happy. I'm a very lucky person to be in the field of hip and knee surgery. I do minimally invasive hips, minimally invasive total knees, and robotic partial knees. I do arthroscopic surgery. And we're all about lifestyle. We're all about getting you back to your activities and feeling a lot better about yourself because your knee doesn't hurt you anymore.
Okay, good. Get evaluated. I want to thank you for coming on the show. Very interesting. But final message, just what? Go in,
Don't be scared to talk to a doctor about your knee problems or your hip problems or any other problems that bother you, because there's a lot of new things out there that you may not know about, and it might help you to know about.
All right. I want to thank you so much for coming on the show. Very interesting. Great topic. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can visit our website at wellnesshour.com. Just click on knee surgery or Dr. Velyvis. And for now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.